It's 2:14 in the morning. The room is dark. You've already woken up once tonight, and now you're awake again, staring at the ceiling because your bladder is telling you it's time for another trip down the hallway. You didn't drink much after dinner. You made sure of that, and yet here you are for the second or third time tonight, feeling your way along a wall in the dark, half asleep, doing math about how many hours are left before your alarm goes off. If that scene sounds familiar, I want to start by telling you something that almost nobody in a 12-minute appointment ever takes the time to say. This is not just getting older, and it is not something you have to quietly accept for the rest of your life. My name is Dr. Richard James. I spend my time studying how the aging body handles sleep, fluid, and the systems that quietly break down after 55, and few symptoms are as common and as poorly explained as this one. The medical term is Nocturia, and in the United States alone, researchers estimate that roughly 50 million adults live with it. Only a fraction of them, somewhere around 10 million, have ever had it formally diagnosed, and fewer than 2 million are getting treatment that actually targets the real cause. Most people are simply told to drink less water in the evening and sent home. That advice on its own is incomplete, and in some cases it can actually make things worse. Today I'm going to walk you through what's really happening inside your kidneys, your bladder, and even your legs while you sleep. And I'm going to give you the actual protocol, the one built on real chronobiology, not a rumor you saw in a video title for reshaping how and when you take in fluids so your body stops fighting you at AM. Stay with me through all 5 parts, because the last one is the piece almost nobody talks about, and it's often the difference between one wake up a night and none at all. Before we get into it, I want to know something. Drop a number in the comments. How many times on average do you wake up to use the bathroom each night? I read every comment, and it helps me know exactly who I'm talking to in this community. Let's get into it. Before I give you the 5-part protocol, I need to explain one concept, because without it, the trick people keep hearing about on social media won't make sense, and you'll be tempted to apply it the wrong way. Here is the concept. Your kidneys are not supposed to work the same way at PM as they do at AM during the day. Your kidneys behave like a factory running at full production, letting fluid pass through fairly freely as you move around, eat, and drink. But at night, a healthy body is supposed to flip an internal switch, a hormone called vasopressin, sometimes called antidiuretic hormone, is supposed to surge while you sleep. Its job is to tell your kidneys to slow down, concentrate the urine, and hold on to water so your bladder doesn't fill up while you're unconscious. In a healthy young adult, less than 1/5 of the day's total urine is produced overnight because of this switch. Here's what changes with age. That nighttime hormone surge flattens out. In many older adults, it disappears almost entirely. Research following aging kidneys over time has found something remarkable. The kidney's maximum ability to concentrate urine drops by roughly 20%, and its ability to conserve solutes drops by about half. The switch that used to flip cleanly at night starts to stick halfway. Doctors have a name for what happens next: nocturnal polyuria. In plain language, it means your kidneys are producing an unfair share of your day's urine, specifically during the hours you're supposed to be asleep, if more than 1/3 of your entire day's urine output happens overnight. That threshold is considered clinically significant, and studies suggest this single mechanism explains the large majority of nocturia cases in adults over 65. But here's the detail that changes everything about how you approach fixing this. Nocturnal polyuria rarely works alone. It very often stacks with a second, completely separate mechanism, one involving gravity, your legs, and fluid that pools in your ankles during the day and then floods back into your bloodstream the moment you lie down. I'll explain exactly how that works in a moment, because understanding both of these mechanisms together, not just one of them, is the entire reason a real bedtime water protocol works, and a simple rule like don't drink after PM usually fails. If you've ever noticed your ankles look a little puffier by dinner time than they did in the morning, type ankles in the comments. That detail matters more than you'd think, and I'll come back to it. Here is something I want to be honest with you about right away. The bedtime water trick you may have seen mentioned online isn't really one trick. It's a 5-part schedule built around how your kidneys, your circulation, and your bladder actually behave across a 24-hour cycle. Skip any one part and the other 4 won't work. Nearly as well, let's go through all 5, in the order your day should actually follow them. Part 1. Front load your fluids in the morning, not the evening. Most people who struggle with nighttime bathroom trips make the same well-intentioned mistake. They panic about drinking too much in the evening, so they underdrink all day then. Catch up in the afternoon and evening because they finally feel thirsty. That pattern is almost the exact opposite of what your body needs. Think of your daily fluid intake like a commuter train schedule. If everyone tries to board during the last 10 minutes before the doors close, the platform gets overwhelmed. But if people spread out and board steadily throughout the day, everything moves smoothly. Your kidneys work the same way. When you consume the majority of your fluid early, your body has hours to process it, filter it, and clear it out before bedtime ever arrives. The practical target most clinicians reference for older adults is somewhere between 1.5 and 2 liters of fluid a day from all sources, and the goal is to get roughly 70 to 80% of that total in before mid-afternoon, ideally by around 3 p.m. I worked with a patient I'll call Walter, 68, a retired mail carrier from Ohio. Walter told me he'd cut out drinking anything after p.m. for over a year, convinced that was the fix. It wasn't working. When we actually mapped his intake hour by hour, we found he was drinking almost nothing until lunchtime, then quietly consuming more than half his daily fluid between 4 and p.m. because that's when he finally felt thirsty. We didn't ask him to drink less. We asked him to drink the same amount, just earlier. Within 2 weeks, his nighttime trips dropped from 3 to 1. Ask yourself honestly, do you drink most of your coffee, tea, and water in the morning, or do you find yourself catching up in the evening? Is your very first glass of water usually well after you've been awake for hours? What to do instead is simple. Keep a glass of water by your bed and drink it the moment you wake up before coffee. Sip consistently through the morning and early afternoon rather than in large bursts. By p.m., you should have already taken in most of what you need for the day. If you're finding this useful so far, type 1 in the comments and let's move to part 2, because this next mechanism surprises almost everyone the first time they hear it. Part 2. The late afternoon leg lift. Here is something that sounds completely unrelated to your bladder, but is actually one of the biggest hidden drivers of nighttime waking in adults over 60. It's what happens to the fluid sitting in your legs by the end of the day. When you're upright for hours at a time, gravity pulls fluid downward. If you have any degree of venous insufficiency, meaning the valves in your leg veins aren't snapping shut as tightly as they used to, or if your heart isn't pumping with quite the same force it once did, fluid seeps out of your blood vessels and settles into the tissue of your lower legs and ankles. This is why so many people notice their socks leave a deeper mark by evening, or their shoes feel slightly tighter after a long day on their feet. Here's the part that connects directly to your nighttime bathroom trips. The moment you lie down flat to sleep, gravity stops working against you. That fluid that spent all day pooling in your ankles begins draining back into your bloodstream. Your body suddenly senses more fluid volume circulating than it expects, and your kidneys respond the only way they know how, by producing more urine right in the middle of the night while you're trying to sleep. Picture a sponge sitting in a puddle all day, soaking up water. The moment you lift that sponge and squeeze it over a sink, all that water comes out at once. That's essentially what your legs are doing to your kidneys every single night, hours after you've gone to bed. I saw this clearly in a patient I'll call Helen, 74, an avid gardener from Arizona. Helen spent most afternoons on her feet in the yard, and by evening her ankles were visibly swollen. She assumed her nighttime bathroom trips had nothing to do with her legs, when we added one simple habit, elevating her legs above heart level. For about 90 minutes in the late afternoon, somewhere between 3 and p.m., her ankles swelling noticeably decreased by bedtime, and her nighttime voids dropped from 3 to 1 within about 10 days. Ask yourself, are your ankles visibly more swollen by 5 or p.m. than they were in the morning? Do your socks leave indentation marks by the end of the day? The solution here costs nothing. In the late afternoon, lie down on a couch or bed and prop your legs up on pillows so they sit above the level of your heart for an hour or two. If you're on your feet a lot during the day, well-fitted compression stockings, the kind you can ask your pharmacist about, can help prevent that fluid from pooling into your ankles in the first place. Part 3. If you take a water pill, timing matters more than you think. This part applies specifically if you or someone you love takes a diuretic, sometimes called a water pill, commonly prescribed for blood pressure or fluid retention. I want to be very clear about something before I explain this. Never change the timing or dose of any prescription medication on your own. This is a conversation to have with your prescribing doctor, not a decision to make alone after watching a video. Here's why the timing question is worth raising. Short-acting diuretics like furosemide are often prescribed to be taken first thing in the morning. For many patients, that works well. But in some people, especially those dealing with the same afternoon leg swelling I just described, a morning-only dose wears off by late afternoon, right when fluid is pooling into the legs again. That sets up the exact same overnight drainage problem we just discussed. Some physicians, in appropriate patients, will consider shifting part of that dose to the late afternoon, roughly between 4 and p.m., so the medication's peak effect lines up with clearing fluid from the legs before bedtime rather than after it. This isn't appropriate for everyone, and it depends entirely on your specific heart, kidney, and blood pressure picture. What to do instead is simple and completely safe. Bring your full medication list to your next appointment and ask directly, is there a reason this is timed the way it is, and could adjusting the timing help with my nighttime urination? That single question, asked at the right appointment, has changed the trajectory for many of my patients. Part 4. The evening fluid cutoff, done correctly, not drastically. This is the part most people get wrong because they take it to an extreme. The instinct is to stop drinking anything at all after dinner. That instinct is understandable. But it can backfire in a way that actually makes nighttime urination worse, not better. Here's the mechanism. When you restrict fluid too aggressively, especially as an older adult, your urine becomes highly concentrated. That concentrated urine carries a heavier load of waste products and irritants that sit against the lining of your bladder. An irritated bladder lining doesn't hold urine calmly. It sends urgent signals at lower volumes, which can mean more trips to the bathroom, not fewer. On top of that, total fluid restriction in older adults raises the risk of dehydration, which itself increases the risk of a sudden drop in blood pressure when you stand, which is one of the more dangerous, underreported causes of nighttime falls. The goal isn't zero fluid after dinner. The goal is a smart cutoff, typically 2 to 4 hours before you plan to sleep, combined with cutting out the hidden sources of fluid people rarely think about. Soups, watermelon, citrus fruit, and large portions of pasta or rice in the evening all carry meaningful water content that your body still has to process overnight. Caffeine and alcohol deserve special mention here. Caffeine directly speeds up kidney filtering and irritates the bladder muscle, and alcohol actively blocks the release of the very hormone, vasopressin, that's supposed to help you concentrate urine and stay dry overnight. Think of it like adding thin, watery oil to an engine that's supposed to run on something thicker and slower moving. It moves through the system too fast at exactly the wrong time. Ask yourself, does your evening routine usually include a glass of wine, a cup of decaf that isn't quite decaf, or a big bowl of soup within a couple of hours of bedtime? The solution is a 2 to 4 hour cutoff on major fluid intake before bed, paired with swapping evening soup or fruit for something with less water content, and treating that evening glass of wine or cup of tea as an occasional choice rather than a nightly habit. If this is connecting some dots for you, type understood in the comments. Because the final part is the one piece almost nobody has ever mentioned to you, and it's often the single most effective step of all 5. Part 5. The double void maneuver, right before you turn off the light. Here is something most people have never been told, and it has nothing to do with how much you drink. It has to do with whether your bladder is actually emptying completely every time you use it. As we age, the bladder muscle itself, called the detrusor, can weaken. In men, an enlarged prostate can physically block part of the outflow. The result in both cases is the same. You finish urinating, but a meaningful amount of urine is left behind, sitting in the bladder. Doctors call this the post-void residual volume. Here's why that number matters so much. If your bladder's total capacity is around 250 milliliters and you're consistently leaving 150 milliliters behind every time, you've quietly shrunk your usable overnight storage down to just 100 milliliters. That's a bladder that's going to signal full far sooner than it should. No matter how well you've timed your fluids, the fix is a simple mechanical adjustment called double voiding. After you urinate for the first time before bed, stay seated for another 30 to 60 seconds. Lean your upper body forward, roughly to a 45-degree angle. Let your abdominal and pelvic muscles relax completely, and gently try to urinate again. Leaning forward changes the angle between your bladder and the tube that drains it, and it uses gentle pressure to help clear out whatever was left behind. Ask yourself, after you finish using the bathroom, do you ever feel like you didn't fully empty, even a little? Have you ever gone right back in 5 or 10 minutes later and produced more than you expected? This single habit, done every night before bed, restores functional storage capacity that many people have been quietly missing for years, and it costs nothing but 30 extra seconds. Before I give you the full action plan, I want to pause on something important. Most nighttime urination in older adults fits exactly what we've covered today, and it responds well to these changes. But there are signs that mean this isn't a fluid timing issue, and it needs a doctor's attention promptly, not a bedtime schedule. Please make an appointment right away if you notice blood in your urine, even a small amount. The same goes for burning or pain when you urinate, especially paired with fever or back pain, which can point to a urinary tract infection. Sudden, rapid swelling in your legs combined with shortness of breath or chest tightness needs urgent evaluation, since that combination can point to the heart, not just the kidneys. And if a spouse or family member has mentioned that you snore heavily, gasp, or seem to stop breathing during sleep, that's worth raising specifically, since a sleep breathing disorder can be quietly driving nighttime urination as well, through a completely different pathway than the one we discussed today. I also want to be direct about medication. There are prescription options, including a hormone medication that directly replaces what your body has stopped producing at night that can meaningfully help nocturnal polyuria, but these medications carry real risks, including a drop in blood sodium that can be serious in older adults. Particularly for anyone also taking certain blood pressure or mood medications, please don't start, stop, or adjust anything based on this video. Bring what you've learned today into the room with your doctor and build the plan together. Here is exactly how to put everything you just learned into practice, organized so it's simple too. Follow starting tonight. Tonight, cut off major fluid intake 2 to 4 hours before bed, not completely, just strategically. Skip the evening soup, the late watermelon, and the nightcap. Before you turn off the light, try the double void maneuver, empty your bladder, sit for 30 to 60 seconds, lean forward, and try again, tomorrow. Morning, keep a glass of water at your bedside and drink it the moment you wake before coffee. Start noticing, just mentally for now, roughly what time your first real drink of the day happens. This week, keep a simple 3-day log of when you drink and roughly how much, along with what time you wake up to use the bathroom each night. This single piece of paper is often more useful to a doctor than an entire appointment's worth of guesswork. Check your ankles at the end of each day this week, specifically around 5 or p.m., and note whether they look more swollen than in the morning. If they do, begin the late afternoon leg elevation habit, 90 minutes with your legs above heart level, sometime between 3 and p.m. If you take a diuretic or any blood pressure medication, write down the exact name and ask your pharmacist this week whether timing adjustments are something worth discussing with your prescriber. Ongoing, if ankle swelling is a consistent pattern for you, ask your doctor about well-fitted compression stockings for daytime wear. Keep a clear, well-lit path to the bathroom, since nighttime falls are a real and serious risk for this exact population, and a simple nightlight can matter more than people realize, and bring your 3-day voiding log to your next appointment, along with the specific question. Based on this pattern, do you think this is nocturnal polyuria, a bladder storage issue, or something else? That question alone tends to completely change the direction of the conversation. Let's bring this together. We covered why your kidneys are supposed to slow down at night and why that internal switch weakens with age. We covered how fluid pooling in your legs during the day can quietly flood back into your bloodstream the moment you lie down. We talked about why total fluid restriction in the evening can backfire, and what a smart cutoff actually looks like instead. And we finished with the one habit almost nobody has ever mentioned to you, the double void maneuver, which can restore bladder capacity you didn't even realize you were missing. I know this might feel like a lot to take in at once, but my goal here was never to overwhelm you. It was to hand you an actual explanation, something more useful than just drink less water, because that advice alone was never going to solve this. Every part of this protocol is something you control. You decide when your first glass of water happens tomorrow morning. You decide whether you spend 90 quiet minutes with your legs up. This week, none of this requires you to change everything overnight. It requires one adjustment at a time, starting with tonight's routine. If this video gave you a clearer picture of what's actually happening while you sleep, share it with someone who's been quietly dealing with the same thing, a parent, a spouse, a friend who mentions being tired all the time without knowing why. This kind of information is worth passing along. If you haven't yet, please subscribe to the channel and turn on notifications, because I bring you research-backed, practical health information like this every single week. And before you go, tell me in the comments, which of these 5 parts are you going to try first? The morning fluid shift, the afternoon leg lift, or the bedtime double void? I read every single comment, and your answer might be exactly what someone else needs to see tonight. Your kidneys and your bladder have been working quietly on your behalf for decades without complaint. Give them a schedule that actually matches how your body works now, and they will return the favor. I'm Dr. Richard James. Take care of your sleep and take care of yourself. I'll see you in the next one.